the policy statements are stuff that we have to go by because this is all we have, right? We don't have any more RCTs that we can get class 1, 2 indications, which will take me to a question, and that would be my last question for the day. In the meeting at AMP, few physicians came to me complaining and sort of requesting some support. And the complaints are some insurance companies are starting to send them letters, you've done 2 procedures or 3 procedures on this patient, 2 surgeries on this patient, or etc. And then the limb is saved, but sometimes the amputation is not a bad thing. I'm not sure if you guys comprehend what I just said. The insurance company is
if you're an insurance company, it's a good thing.
Company, right?
Advocating to this physician to actually consider amputation.
This is a huge problem right there, because it shows they don't understand how this disease works. They don't. I mean, it's and I throw this out there too. Are you going to tell somebody? Are you going to limit the number of cancer treatments somebody has access to? I mean, no.
Remember, guys, they did that a few years ago, right? Before the President Obama signed the Act for Reduction in Cancer Percentage in 2013, I think, or something around that time. I mean, it was what actually triggered that back then, because insurance companies started to cut out some chemotherapy or skip on some things like that, right?
Even your ability to go get screened. They add another 10 years to it. It's like, some actuary somewhere is probably thinking, well, some of those guys will be dead, so then they'll be off the record too.
And back to economy, right? We just published this paper just recently, and the authors in these papers are phenomenal people, and one of them is actually sort of a physician, but also an economic physician. In this manuscript that we just published in the Journal of Medical Economics, no matter which way we looked at it in so many different ways in terms of statistics. If you get an amputation, the cost of the healthcare is significantly higher, almost by $60,000 per year higher. No matter which age, which time, no matter what you did, if you did an amputation, the cost of the care is $60,000 higher per year. We just published this latest publications. So we need to stop this sort of dogma of if you amputate someone's leg, the problem will stop or the cost will stop, etc.
Yeah.
It might affect the insurance company itself. I'm not sure really, but no one has the right to tell a physician, stop treating a patient, let him get an amputation. That is just wrong.
Exactly.
We have an ethical and moral oath that we took that we're going to do everything we can to help somebody. And there's data here just got published saying that save a limb, because if you do save a limb, you save a life. But also on top of that, you save the healthcare system $60,000 a year. That's a lot of money.
And it speaks to the point I've said for years, when you amputate somebody's leg, you're not solving a problem, you're creating a whole host of new problems, not just for the patient, but for well beyond that.
It dominoes.
It really does.
I lost count of the number of people who consulted me when I was in the wound care world, and they asked me to see their patient and tell them that they had no choice but to have an amputation. Happened all the time.
Hopefully, I really feel optimistic of this discussion. I really do, and I'm going to be reaching out to Des and find his bus here in Michigan as soon as possible.
Yeah, just so you know, we're coming up to we're going to be up in Minnesota in November.
Okay.
That's more for that. That's going to be sort of I don't want to speak out of turn right now, but we would love to plan for future to get things going for 2022 and beyond. We've got the capability to do this. We just, like I said, funding's our biggest thing right now. We're still, it's funny about our organization. People think we're a lot bigger than we are. But it's really been kind of me in my man cave, and then a couple of good people helping me out too now. But part of it, because we started this white sock campaign, to create public awareness, kind of like the ice bucket challenge. Everybody was familiar with that, but when we started, hey, put on a white sock and take pictures and post it, use social media, it'll start to go viral. And it's gotten bigger every year, but we're not able to track data for that. But it's kind of getting the message out there. At least people start to hear about PAD. But to have this program go out and do screenings, this is, again, there's multiple ways to solve the problem. It's not just like one simple solution. You've got to hit it from between messaging, driving the message to the public, getting the public engaged, getting the providers to understand what's at stake. It just goes on, and obviously the payers too. So anyway.
If you screen, you have a policy statement here that states, right, for an American Heart Association with multidisciplinary authors from every specialty, they're stating in this, saying that there's 7% reduction in mortality if you do screening for PAD. I mean, there's nothing more powerful than that, right? So I would go for it.
Yeah, let's play that up for sure.
Thank you so much for joining us for this discussion today. If you would like to learn more about our guests, head on over to our Patreon page where you can access exclusive content, including the full segment of our show. Never want to miss an Inside the Doctor's Lounge clip? Be sure to click the subscribe button to our MD Coach's YouTube channel. As always, we appreciate suggestions for future show topics. Let us know what you're thinking in the comments below. And finally, special thanks to Ryan Jones, who created and performs our theme music for the show.